You're listening to The Q Switch with your host, Spence.
Welcome, one and all, to the Q Switch Conversations podcast. I'm your host, Spence, and the mission of this show is to tackle subjects currently impacting ophthalmology and pull in leading eye care professionals and industry players to discuss their unique perspectives. So let's jump right in. Today's show features Alberto Osio, Chief Executive Officer at Yolia Health, who will be sharing his take on the top trends in ophthalmology in 2025. Alberto, welcome to Q Switch and making time for us today. Where are you calling from?
It's an honor. I'm calling from San Diego, California.
Okay, cool. Well, thanks a lot for joining us. I know I'm on the East Coast in Miami, so it's a couple hours ahead of you. So thanks a lot for getting up early and taking time out of your day. So how has 25 started off for you and your team at Yolia Health?
Amazing. We believe that our venture with J-Labs, Johnson & Johnson in Singapore, and our next studies in Mexico at the University of Aguascalientes are going to be amazing. This year is going to be very promising for Yolia.
Well, good. Well, we'll look forward to all the things you have coming to market. Let's start by having you share the origin story of Yolia Health and maybe include the light bulb moment that put you on the path to where you are today.
Thank you, Spence. Well, that is a very interesting question. Well, believe it or not, and maybe you already and your audience already knows, ophthalmology has many roots, and one of those started in Colombia, in Bogota, at the Barraquer Institute of the Americas. So Jose Ignacio Barraquer has been tremendous in the bringings of innovation in ophthalmology. LASIK, CK, many instruments, a lot of cornea relays, many of those innovations. So my father, Dr. Alberto Osio, was among those ophthalmologists that in the 70s was at Colombia. And so bringing this story more towards this era, I was a student at MIT, and my father called me one day and told me about the research he was doing. Basically, Yolia has developed the Invisalign for the eyes. We have been able to use customized contact lenses and enzymatic eye drops to reshape the curvature of the cornea.
Whoa.
And so using these customized contact lenses and eye drops, we can correct vision in up to 3 days, up to 5 days at most, using this technology. And this can last for up to 12 months.
Wait, what? One treatment lasts up to 12 months?
That is correct. So
Okay.
imagine waking up using contact lenses during the day, using a couple of eye drops during the day.
Mm-hmm.
And as in 3 days, we can fix your problem for 12 months. Now,
Sounds like a bit of sci-fi out there.
I know. And this is too
Doesn't
much.
sound.
This is
How
too
do
much
things line up?
information for the first couple of minutes of the podcast. So basically, the first treatment that we have fully developed, and it's going through FDA as we speak, is trying to correct presbyopia.
Okay.
And so these contact lenses fitted the way we fit these contact lenses can create multifocal corneas. So these multifocality effect can allow patients to see well for near, intermediate, and distance vision at the same time.
Mm-hmm. So, you've already kind of gotten ahead of me here, but let me go and get to my first real question. Almost speaks to what you've already really kind of laid out there, because innovation and advances in medicine are always chasing problems in order to develop new and better solutions. And so, what do you see as the biggest problem currently being chased down in ophthalmology, and what problems are you and Yolia Health focused on? Which I think you just answered when you talk about really attacking presbyopia as a problem. Can you share more about that?
Of course, and I think it's a little bit more complicated than that because obviously ophthalmology has been very precise in terms of using technology and using lasers to correct and to change in this case the refraction of the cornea. I think there's also been a tendency to use non-invasive treatment, so try to find non-invasive approaches to do exactly the same thing. And so, for example, since the 1960s, orthokeratology has been a trend towards a non-invasive approach to correct refractive errors.
Mm-hmm.
Nowadays, I believe that these non-invasive approaches are going to be more explored, and they're going to be even better solutions than the typical invasive procedures.
And again, I've been in the eye care space for quite some time. Most of that experience is on the cataract side. So it's all about, the cataract procedure. And of course, those are invasive. Even when it's laser assisted with LensX or the Catalyst, it's still an invasive procedure. Healing times are quicker with, the type of surgery they're doing now with the phaco and the lasers. So it's getting less and less invasive. But you're saying non-invasive altogether. So no touching of the cornea, no incisions, no nothing.
Well, obviously, cataracts and other invasive procedures are different than I'm focusing on the refractive side of
Okay, so you're more
vision
along
correction.
so you're more along the lines of like LASIK. So that's kind of where you are positioning yourself.
That is correct. That
Okay,
is
all
correct.
right, I understand.
Well, the story is that, well, Yolia is a Mexican company. The technology was born in Mexico with a lot of collaborations from different researchers, including people at MIT, for example, Ken Kenyon, who's among the most respected ophthalmologists in the US, and many others who have brought together the best in ophthalmology, the best in optometry, and the best in chemistry. I would like also to mention, for example, in optometry, Dr. Stuart Grant and Charles May, who were the thought leaders in orthokeratology and contact lens designs. So we're using the best approaches from optometry and ophthalmology to bring together something that is non-invasive, that is not permanent, that can be retreated, that can be reversed. And many people have, for example, have expressed that what we're doing is similar to the Invisalign for the eyes.
Okay, you mentioned that before, and again, that's kind of a known thing now. If you're looking to correct your bite and crooked teeth, and they send you the kit and you send it back, and they send you. It's a super easy process. It wasn't always like that, but now it's kind of just one of those things that we have in society that people can just. It's like going to the market and buying a loaf of bread.
Exactly that. And obviously, this has taken. I mean, it's been a long journey. It's been something that we have a lot of promising treatments in the pipeline. So it's not only presbyopia.
Oh,
We're right now we're incubated at J Labs in Singapore, and so we're bringing the technology to Asia. As you might know, Spence, the population in Asia, it is one of the most affected, or it is a tendency that myopia affects the Asian population quite a lot.
yeah, because of the anatomy of the eye.
Exactly, and they spend a lot of time indoors and in front of computers, and that's everyone in the world.
Sure.
So we're taking our technology to Asia with presbyopia. We're also in the middle of conducting a very large study in Mexico, so we can further enhance our pipeline with our treatment and finding a way to control the myopia progression.
Okay.
So the same multifocality effect that we're using for the presbyopia population, we believe that can be used or can be in a better approach used to control the myopia.
Okay. All right. Let me ask you this. Like I said, doctor, much of my career was spent on the cataract side, focused mostly on advanced technology IOLs. And in my experience, patient selection was a major factor on whether or not somebody qualified for a certain IOL. What do the patient selection criteria look like for someone to be eligible for and benefit the most from true vision treatment?
Spencer, that is always the most important question. You know what? TVT or true vision treatment is a very very subtle treatment. So we select patients that can handle contact lenses, obviously. Also, patients that have low to moderate refractive errors, so up to 1.50 of myopia, with up to 0.75 of diopters of astigmatism. So in this case, in presbyopia, we're focusing on patients that can see fairly well at distance without eyeglasses, and now are needing reading glasses for their first time. As you know, presbyopia is something that everybody over the age of 40 is going through. And nowadays, with the use of technology, we believe that treatments like ours are ideal for the first stages of presbyopia. This is something that can be retreated as often as needed, so it's only a couple of days of using both the contact lenses and the eye drops. And as soon as the treatment is over, the patients can stop using their reading glasses for up to 12 months at a time.
Okay. And you mentioned that you are operating out of J Labs in, was it Singapore? What was it at again?
Yes, in Singapore. That is
In
correct, Spence.
Singapore. And that you had, it's up and running in I believe it's Mexico. So why don't you tell me where a True Vision treatment is being offered globally and where it is available in the United States, if at all, at this point? Because you mentioned it's going through
Of
FDA
course.
approval. So you can talk,
Of course,
can you
of
speak
course.
to that a little bit?
Of course. So Yolia has been awarded with the approval in Mexico. What we're doing in Mexico is collecting data because the US FDA has allowed us to use the Mexican data to further enhance or to further advance the FDA approval. So we're collecting data in Mexico that is up and running. We're also collaborating with the University of Aguascalientes in Mexico, where we're conducting not only presbyopia studies, but also myopia studies. And at the same time, or in parallel, in JLab Singapore, we're bringing the technology to Asia. So everything that we're doing right now in Mexico is being considered for us to be a research hub or a innovation hub.
Mm-hmm.
We're treating it as a springboard to other countries in the world.
So with this patient population, it sounds like that if they're in their late 30s, early 40s, that early onset when you get the first signs of presbyopia, it sounds like you would be an alternative to a LASIK procedure or maybe like even ICL. Does that sound about right? And can you kind of speak to like what's the alternative? What are current, I guess, procedures being done now? What are the current solutions that TVT is going to be bringing as an alternative that, again, being non-invasive? What is it going to compete with?
Great question. So as many people are aware, so presbyopia is a condition that is both refractive and but also very complicated to treat with surgery. So the typical solution with surgical procedures are monovision. Obviously, treating the non-dominant eye so that patients can see both at the distance and near. Other treatments more common right now are using eye drops to create a pinhole effect. For example, using pilocarpine or other eye drop solutions.
Mm-hmm.
Now, these are very temporary solutions that have been in the market for decades. What we're bringing is something that is both comfortable for the patient,
Mm-hmm.
very practical, and long lasting, without compromising any distance vision. So by using both the contact lenses and eye drops and the way these contact lenses are designed and the way these contact lenses are fitted, we're able to create this multifocality effect that can allow patients to see well for near, intermediate, and distance vision at the same time. And as I mentioned before, because we had very talented advisors and people advising and designing these contact lenses, it is very easy for the patients to use the technology and to be able to see very well.
So I know that you have the research hub in Mexico. You have the J Labs in Singapore. You mentioned going to a mass market that speaks to this technology in all over Asia. With kind of those steps in line, when can we expect to see this technology and this treatment available here in the U.S. with the FDA kind of on the horizon?
We believe that we can be in the US in about 2 years. We're using a combination of already approved FDA treatments or products. We're using contact lenses. The material of the contact lenses has already been approved in the US.
Of course.
The only thing different there is the unique design that we're using for the contact lenses. Now, the eye drops, we use two enzymes that have already also been approved in the US, hyaluronidase and collagenase.
Mm-hmm.
So the unique combination of these two enzymes, together with a unique contact lens design, that's the mechanism of action. So the FDA has allowed us to use the Mexican data to further advance this FDA pathway. We're going to conduct a single pivotal study, meaning that we don't we're not going to go through the same or the typical phase 1, phase 2 studies. We're going to use the Mexican data together with the safety data that we're collecting in Mexico and in other parts in the world so that we can submit the safety profile to the FDA. So to answer your question, we believe that in up to 2 years, we'll have this treatment available in the US, not only for presbyopia, but at the same time, we're conducting studies for myopia and myopia progression.
And that's actually 2 years comes fast. It's actually not that long, especially if things really really start moving with that process. And like I said, you have all the established data. You're working with existing technologies, just really marrying them together to create something new. Certainly Godspeed with that. So again, this may be a little bit too far ahead, but my next question is, what's the model for practice wanted to offer the True Vision treatment as a solution, and how do they go about getting certified, trained, and from a business and administrative standpoint, what is all involved?
Great question. Correcting vision is not only available or offered by an ophthalmologist, but also by optometrists.
Of course.
And so we believe that optometry needs to be one of our gatekeepers in regards to offering this technology. This practice is the best suited for fitting specialty contact lenses, for example, and for being at the front of vision treatments. And so what we believe is that partnering with optometry practices and also with ophthalmology practices that include optometry in their office is the ideal business model. So for heads up, we believe that training and certifying the eye care practitioner and allowing them to treat or to use our treatment is going to be the best solution.
Okay. So, and as you say that, I mean, it does sound to me it is more OD channel heavy because they're part of their main driver in their practices that they've been doing, checks and this kind of thing is outfitting patients for contact lenses. They can probably do it blindfolded on any given day for an entire day, whereas ophthalmologists aren't as in line with that activity. But the good news is that in the U.S., as you probably know, that co-management is it's here to stay. I mean, ophthalmologists, they don't work by themselves. They rely on those OD networks to supply them with patients to perform surgery on, and again, they co-manage. So I think the environment is rich for those partnerships to really flourish and support this technology. So I got to say, on behalf of my friends in the private practice space, I got to ask, as good as True Vision treatment is for the patient and all the things you speak to with ease of use and the semi-permanent reversible impact, the comfort, and all these things, that's well and good. But I'd stand to say that my private practitioners and administrators of any practice will want to know what is the return on their investment, and simply put, is it profitable? and while you're at it, do you think that this will be a strictly patient pay technology, or will it at some point be covered by insurances?
We believe that this is going to be of pocket expense.
Okay, patient pay technology. Okay.
Patient paid technology. And to answer your question this way, our patients are happy patients and our customers, our doctors are happy doctors. Using contact lenses and eye drops is a very affordable solution for both. It is in the art of selecting the patient, coaching the patient of using contact lenses. Many of these patients have never worn contact lenses in their lives. So there's a learning curve for the patient as well. But these patients, after the treatment, are going to be the most loyal patients or the most loyal customers for that practice. Not only for their own refractive treatments every 6 months or every 12 months at a time, but also bringing other friends and buying other products at the practice. So it is happy patients, about happy patients, happy doctors. It's the simplicity of using contact lenses and providing the eye drops is very simple again. Now let me further explain, because I'm thinking in Spanish and trying to translate in English.
Sure.
Our contact lenses for 3 days, because I have not explained the protocol. So once these contact lenses are fitted, and the patient takes the treatment to their home, and they started using the contact lenses during the day, it's only 8 hours a day and using the eye drops during that time. So the patients don't sleep with the contact lenses. It's only a daily treatment. So it's only 3 days of using the contact lenses and eye drops to be fixed with for 12 months at a time.
Are there any adverse effects? I mean, I know like with, say, LASIK and some of those refractive procedures, that dry eye is kind of a common thing that just, and you're talking about almost not really reshaping the cornea, but certainly affecting the cornea. Are there any side effects or any things that doctors or patients should be mindful of if they take on this procedure or this
Sure,
treatment?
we select patients that have a healthy cornea.
Okay.
So a dry eye might not be applicable for this treatment. We use gas permeable contact lenses. So using the same criteria, inclusion criteria for any specialty contact lens patient would be enough. Obviously, we're using hyaluronidase and collagenase if those are one of the symptoms of a patient that they cannot tolerate hyaluronidase or collagenase. Obviously, we would exclude that as well.
Okay.
But this is using already approved US FDA components in a unique manner. So it's going to be fairly tolerable for patients.
I see. And what about patients who may have had previous refractive procedures like LASIK? I mean, those folks don't. They may have a healthy cornea, but they've had their cornea changed. Is that somebody? Are those folks eligible or ineligible for this treatment?
It depends on the severity of the irregular astigmatism that
Okay.
we see in the patients. Obviously, those patients that have been previously treated with surgical procedures are tough to consider. But what is really incredible about our treatment is that because it's non-invasive, because it is very manageable in terms of what we are trying to do, either flattening or steepening the cornea, we can adapt contact lenses to irregular corneas.
I see.
So depending on the severity of the irregular astigmatism, those patients are also candidates. We've had wonderful patients with LASIK, and even if you don't believe it or not, with RK radial keratotomy. So that is still, you'll see those patients still in Mexico. So imagine those corneas are super irregular, and so
And you had
we've been.
and these folks have had success with TVT.
That is correct.
Oh wow. Okay. Fantastic. Well, I asked because that means the patient pool is quite large. It's not, you can initially see that, oh, we have these great patients, but then if they have this, if they have this, if they have this, if they have this, then it becomes this small lane of patients that are eligible for the treatment. You're saying really and truly that really there's very little that would prevent a patient from being considered for this treatment. And you mentioned earlier that is, I think you said reversible was the word you used.
Yes, that is correct. I want to say that, well, obviously, depending on the degree of diopters you want to treat, there's limits for non-invasive treatments, and there are also ideal patients for refractive procedures. I think where TVT is more, it's ideal for those patients who are in the threshold between a refractive procedure,
Okay.
that are considering a refractive procedure, and doctors who would not consider maybe a second surgical procedure. There are many successful cases in our company that we have treated. For example, we have bundled, for example, with LASIK. So once a patient undergoes LASIK, there's always a refractive error left behind.
Yes.
And so a couple of weeks afterwards, we're able to combine our treatment with a LASIK procedure and being able to fine tune that refractive error. So in a way, we're providing a better spherical cornea, less halos, less starburst, less irregular astigmatism, being able to change the circumference of the cornea in a way that is manageable, in a way that is very controlled. Again, we're using the principles of orthokeratology combined with what we already have approved in the US and worldwide, the using of hyaluronidase and collagenase to make the cornea more malleable. So the combination of these two components has been very well tolerated, and it's impressive what we can still do with these with this technology, and that's why we're very happy to be at Singapore and in JLabs, because we're going to bring this technology to Asia and trying to change many vision problems.
So I have two more questions for you. In terms of, you said you'd have to obviously coach or train or put the patient through some protocols because once they leave the clinic, it's on them to administer the contacts and the drops themselves. And what have you seen, or what would you say if asked you about the compliance piece? Anytime you talk about drops, and again, being in my area of experience, post-operative cataract, getting a steroid, an NSAID, and an antibiotic for someone to comply, it can be challenging. Is this drop regimen, along with the contact, is it something that most folks can comply with and stay on track so they can get a complete treatment?
It is extremely compliant, an issue of patient compliance. The training of how to wear contact lenses. Many of these patients, remember that, presbyopia affects everyone over the age of 40. And so many of these patients have had in their previous life, they've never worn eyeglasses. They're patients that have good distance vision. So training them on the art of putting contact lenses on, that's challenging enough. However, the experience that the patient goes through and the benefits they see on a daily basis, that makes them even more motivated to continue using the treatment. One of the areas we're exploring is using drug-eluting contact lenses.
Oh, wow.
So we can eliminate the use of the eye drops.
Like a time release.
Like a time release, exactly.
Okay.
So nowadays there are technologies that can be used or put together with ours so that we can make this experience even better. We're not the first company to try to do this.
Really?
Spence.
Yeah. To me, it seems like this is like if someone actually gave this a go before, huh?
No. Orthokeratology is something that many people don't like to talk about, but
Never heard of it.
Challenging. And in the early 90s, there was a company here in Southern California called, I think it was Advanced Corneal Systems, and they were injecting hyaluronidase in the cornea, in the stroma, and using orthokeratology lenses to try to do exactly the same thing. So there's been the invasive approach using enzymes. There has been other approaches using other types of solutions together with contact lenses. So we believe that it's not only about using contact lenses and malleable solutions, it's about not being permanent. These past solutions were trying to come up with a permanent solution. In terms of myopia progression and in terms of presbyopia, this is an ongoing problem, right? So every year your vision changes.
Right.
So being able to use a treatment that can be repeatable and very manageable, it is in the best interest of the patient and also of the doctor.
Well, I would tell you this, that as you're explaining more in detail this therapy, that the one thing that comes to mind, again, given my background with cataract surgery, is it's pretty commonplace now, but it's a clear lens exchange. It's those patients who have that elective cataract surgery in that 40, 50-year age range where they're not eligible, they don't have a cataract, they just want to improve their vision. So first of all, it costs a lot of money, but also invasive. So I think a lot of practices that have patients who are either risk averse in terms of putting a knife in their eye and going that way, but also I think from a budget standpoint, this is more manageable in terms of budget access for many customers in that demographic. I think as I'm thinking that where this can really be successful, that's where I think that practice can really provide a really great lower cost alternative to get a similar or even better result that's safer and more patient friendly, let's just call it.
Totally agree, Spence.
So Alberto, this show was about top trends in ophthalmology, and TVT and Yolia Health is really not just a trend, but it's an emerging technology. I think that will be on trend, and once it gets here, it'll be here to stay. So I want to thank you for sharing your company, the technology, and what you're doing to add this solution to the eye care space. So before we sign off, if any of our viewers wanted to connect with you to learn more about Yolia Health and TVT, where can they find you?
They can find us directly in our website at www.yolia.com, YOLIA.com. And Yolia is an Aztec word that means eternal life, eternal youth. Just a
thank you.
clever way of explaining what we're doing.
There's always a story behind the name, and thanks for sharing that as well. Well, we'd like to thank Riverside FM and Passionate Media for making this show possible. That's a wrap for this episode of the Q Switch Conversations podcast. Until next time, This is Spence, and I'm out.
You're listening to The Q Switch with your host, Spence.